So thank you all very much. Thank you, Karthik, for that amazing um, introduction. I don't know if I deserve that much, but anyway. So what we're going to do today, I'll go straight to the topic, and I think the way we'll do this is I'll go through the presentation, but I'm sure there'll be lots of questions that come along, and I'm also going to judge very much by the questions you ask in the group, um, and then answer any questions and tailor the presentation a little bit. So what we're doing today is really just an introduction to the FRCR exams, and it's titled there, Becoming a Better Radiologist via the FRCR exams. And the reason we do that is I really am a big believer that the FRCR exams makes you a better radiologist. Okay. So what we're discussing is, why do you want to do the FRCR? A little bit about the FRCR Part 1, the 2A and the 2B. Now, many of you may be in different sort of timelines regarding this. Some of you may not have even started. Some of you may be reached up to 2A and then stuck, or reached up to 2B and then stuck. So I'm hoping that I can give you some useful information at all different stages, and you don't really get bored at any stage. The FRCR exams is the fellowship of the Royal College of Radiologists, which is the body in the UK that, if you like, the oversees radiology training. And it's the group responsible for both radiology training and specialization in clinical oncology and clinical radiology. And I have to just stress the word here, clinical radiology. And that whole sort of clinical sort of tilt to the whole thing is, you can see that right from anatomy right up to the 2B exam. It is very, very different in that sense from a lot of other exams around the world. Probably the ones that come closest are the FRCR in Australia, and perhaps there's a new exam in India called the MICR. Those exams kind of come closer, but I think the FRCR is probably the one that really is a clinical radiology exam. So what they are trying to do there is to see, are you safe to be a practicing clinical radiologist? How can you give clinical input? So, and the FRCR is the exam, the qualifying exam that you need in order to prove that you've got the skills and the knowledge to practice as an independent radiologist in the UK. Now, there are other routes, and they do recognize exams like the FRCR. They do recognize certain European qualifications, which I don't know what the state will be following Brexit, but your best bet is to get yourself an FRCR. And it's a very, very possible exam. I must say, it is not rocket science. It's not incredibly difficult. If you know how if you understand the thinking behind and the way that radiology is practiced in the UK. Because once you pass the FRCR, I would like to say, actually, the world is sort of your oyster. It is recognized in many, many places. It's obviously the gateway to do radiology in the UK. It's the gateway to get CSER, which is the completion, or the certificate of equivalence of specialist. I'm not sure if it's radiology or training, but it's the sort of the certificate you need in order to be a consultant. But you don't need to get CSER to practice after the FRCR. So after you get the FRCR, you can actually practice in the UK as a sort of junior doctor, as a what we call a trust grade or locum consultant grade. You can take up roles like that, but you won't be able to practice independently unless you have either the CSER or in the UK candidates go. If you're a UK trainee, you get what is known as the CCT, certificate of completion of training, and therefore, but the FRCR is sort of the basic qualification you need before you can even get onto those journeys. Okay. Now, um, so good question. You're based maybe in Africa or India, and you're thinking, why should I sit the FRCR exam? What's the point? Okay. Um, I think when I've been doing this now, we've been running FRCR courses for over 15 years now. Since 2008, I've been, and we often ask people why, people from abroad particularly, why do you sit this exam? What's motivating you? And and funnily, the most common response I get is not that I can get, more money or I can get more, more opportunities or promotion. Actually, most people are doing it just to prove to themselves that they're a good radiologist. It's almost like the FRCR gives you that. I mean, you probably have got an MD from a very good institution in your local country, in India or in Africa or in the Middle East, but you want something that gives you a standing internationally. And so many people do it to prove to themselves and to other people that they're capable and that they're safe. And they're safe to be let out, if you like, to practice independently. It also gives you the ability to work in a lot of countries. For example, the FRCR, if you have the FR, you can work in the UK, obviously, Ireland, you can work in Hong Kong and Singapore, and in many Middle Eastern countries. It's an additional useful role qualification to have. And in some places, it does actually improve your chances of getting a promotion. As I said before, it gives you an international recognized qualification and potentially opportunities for more income and promotion. And I just want to highlight here that if you have the FRCR and you also go through the process of CSER, which takes between 1 and 2 years because of the volume of information you need to get. And certainly, I am looking at how we can create a course to support people through CSER. Um, that then opens up the opportunity for you to live in your lovely country, wherever it is, in lovely Rwanda, where it's nice and warm, and or in India, and you don't even have to come to the UK. You can work for a teleradiology company based in the UK and be earning, hundreds of thousands of pounds per year, which in your countries could be quite significant. So I would say that that's another opportunity for you, that you don't really even need to move to the UK to start reaping the benefits. So let's go through the exam. The exam is divided into three distinct bits. And during the exam, the candidate's knowledge is tested against the specialty training curriculum for clinical radiology. And if you go to the website, to the Royal College website, you can actually have a look at the specialty training curriculum. And I'm just going to ask Joanna here to, if you can find the link, if you can just put that link on the website, then people can look at the specialty training curriculum. Now, the exams need to be completed consecutively, which means you have to finish part one, and then you are eligible to sit part 2A, and then once you finish part 2A, you sit 2B. So let's just go to the first part, which is part one. It's split into two bits, anatomy and physics, and the exams are run one day after the other. Okay. So anatomy, I think it's physics first and anatomy, I'm not sure, but it's one day, it's consecutive days. And if you fail the anatomy, you don't have to resit it again. You can sit just the physics. Um, the and then there's the first FRCR, and then they call it the final FRCR. But the final FRCR can look very long, and especially if you've just finished 2A, it doesn't feel quite final. But the 2A exam is really the theory test. It's the theory test of your clinical radiology knowledge. And if I show you a question, which I will do very soon, you will see the kind of questions they ask are very different to the kind of questions that you might have encountered in your own local examinations. The part B, which is which you have to finish 2A, and then you can apply for 2B pretty much straight away, is split into three parts. And we'll go into that in a minute. So let's just move on.
Koshy,
Yeah.
your slide.
Yeah, sure.
Koshy, your
Sorry, I I think you're breaking
yet
up,
to
or
see your slides.
oh my, I am really sorry. I forgot to.
So probably it might be me.
That's okay. I can just go through
Yeah,
this then.
screen share.
So here it is. These are the slides, but actually it doesn't matter. I've explained it. I'll explain to you now the first part. Okay. So when we look at the first part of the exam is split into two modules, anatomy and physics. Okay. We've said that. And in the physics module, the candidate is tested against the basic physical concepts that are used in diagnostic medical imaging. So if you look at, and in anatomy, the candidates are testing about basic anatomy that they need to perform and interpret. But the good thing about this exam is that unlike the old days when you had to sort of know the sort of course, you have to know the course of the nerves and you have to know which muscle is connected in relation to this muscle. The way we learned anatomy in medical school, this exam is very clinical, and I'll show you why. Let's just see the first one. That's an anatomy question. And all they're asking is name the arrowed structure, or they might ask a variation based on an image. So they give you an image, and they give you, I think it's 100 images in an exam, and you have to name the arrowed structure, or it'll be a question related to an arrow in some way. Um, and so, how do you prepare for this? Well, the best way is to simply look at an atlas of some sort. That's literally all you need to do to get good at anatomy. You don't really need to look at lots of textbooks and know the relationship of this and that. If you know on an X-ray what the various bones are, what the various parts of the hand X-ray are, and you can be tested on any modality and any part of the body, and so if you use a good atlas, and I would suggest you use an electronic atlas, and I'll give you a suggestion in a minute, then that's pretty much all you need for anatomy. Okay. And some practice questions just to test yourself. For physics, um, it is very much the old physics sort of questions. And this is probably it is connected to clinical practice, even though I must say physics never feels connected to clinical practice. But what they do here is they give you a statement, which is the stem, and then they give you five choices, and each choice you have to say true or false. Okay. And you get the correct answer for a true question. And if you put um, if you get it wrong, you don't get negative marks, which is a big advantage compared to the way when I sat the exam, there were negative marks, particularly in the 2B, in the 2A exam. So now, if you just have to get the correct, if you say true, so there's literally a 50% chance of getting one of the choices correct. Okay. Now, I'm not going to even try and answer this question because that was a long time ago. um, and in terms of what do you need before you can sit the exam, literally anyone who is in clinical radiology training anywhere in the world or has undertaken such training in the past can sit the exam. Okay, there is no other requirement or qualification. You can sit the exam if you've done or are in clinical radiology training. Let's go on to the 2A then. So 2A is really about testing your radiology knowledge. And what they are testing is the things that you need to know are the sciences that radiologists use in their practice, the most current radiological features in relation to pathological and normal conditions, differential diagnosis, management pathways, and a little bit about radiology intervention, and also things around procedures, I would say, procedures and that kind of stuff. So And the way they mix up the paper, you have two papers, and they mix it up, and they give you questions from cardiovascular and vascular, cardiothoracic and vascular, musculoskeletal and trauma, gastrointestinal, genitourinary, adrenal, obstetrics, gynecology, and breast, which is one section, pediatrics, and then the central nervous system. And if you go to the college website, there's quite a bit about how they mix it up. Okay, so a typical question would be one like this, where they give a question like a 76-year-old lady, is undertook an MRI scan for local staging. Her case was discussed in a local MDT. The radiologist points to invasion of a thin black line on T2 weighted sequences. So it's very much how you would practice radiology. And it's a very clinical scenario. And they're saying that the tumor is breached and a decision has been made that they're going to receive chemotherapy. So, what structure is seen as a thin black line in T2 weighted? So, they're very much testing what you see and what you do rather than the five common causes, the least likely cause of a nodule in the lung is A, B, C, D, E. They're not testing theoretical knowledge. They're very much testing practical knowledge. Okay. So if you prepare for 2A, it's incredibly useful for 2B. And I'll tell you a little bit about how to prepare for this exam. Qualifications needed for the 2A is you must have passed 2A physics, you must have physics and anatomy, you should have passed part one, and you should have taken 24 months of radiology training. So, and then you can sit 2A exams. Okay, you have to finish 24 hours, months of radiology training, which is 2 years. Once you've done 2 years of training, you can sit the 2A exam. Finally, we go to the 2B exam. So what is the 2B exam about? What they're looking for now is designed to test whether you can use your knowledge and skills effectively as an independent consultant. And the exam consists of 3 parts, and they're testing different parts of your practice when they're testing it. So there's the rapid reporting, there's the long cases, and the vivas. So rapid reporting. Now, as a radiologist, you have to look at plain films, especially in the UK. You have to look at plain films. Now, I know that in some countries, plain films is not something that radiologists look at. And in fact, in some places, they get literally very little plain film practice, which is why, and fracture identification and things like that. That's things which the orthopedics people do, or the chest physician does, or the abdominal doctor, the GI doctor does, but the surgeon does, and it's often not the radiologist in these countries. However, in the UK, the radiologists are a fundamental part of that process. So this exam, which very many people find extremely challenging, is basically 30 X-rays that you could get in clinical practice. There are normals and there are abnormals. And all you are trying to do, I'm going to say this, is pick out the normals, because that's the most difficult bit, and pick up the abnormals and identify what the abnormal is. And it's very easy to do if you've got enough practice, if you've seen enough work in your day-to-day work and you don't overcall, then it's very easy to pass the rapid reporting. And especially if you use a platform that is balanced, where the 30 questions that you get 30 x-rays, approximately 40 to 60% are normals, approximately 40 to 50% are abnormals. And what you are doing is picking up the normals. That I'd like to turn it around and say that's what they're trying to test, because they don't want you to pick up, they don't want you to call normals abnormals, because that creates a workload on the NHS. But they also, if you pick up an abnormal, they want you to be able to identify it correctly and say what it is. And they're all x-rays. They're x-rays and there's only one abnormality. They've made it really simple for you. There's only one abnormality on the X-ray. So if you use a platform like Revised Radiology, I mean, I'd say, tell that's a really good. The reason is that we've balanced it. So every packet is exactly like the college exam. It's and the pass mark is about 90%. If you get 27 out of 30 questions, you'll pass the exam. It might sound like a lot, but guys, think about this. If you were to miss 10% of your cases in daily practice, I reckon you'd be considered a poor radiologist. So my view is that you should be aiming for 95 to 98% in this exam to prove to yourself that you're good. If you fail the rapid reporting, there's a problem because you're not very good at picking up x-rays and you overcall stuff or you undercall stuff. So it's with enough practice, I believe people can score 100% on the rapids. And there's a big advantage in doing that because in the actual exam, you there's one viva, there's one long case packet, and there's two vivas. Okay, so there's rapid reporting, long cases, or reporting they call it, and two vivas. You only have to pass two of them, and you have to get a score that is the pass mark overall to pass the exam. So with the long cases, what they're trying to test is your ability to write your findings. Little bit old-fashioned, I suppose, but it depends. In some countries, they still type their reports. In the UK, most people use voice dictation. So I'm hoping that in future the exam will include voice recognition. But they're testing your written report and the way that you write it, and you have to write it in a particular order: findings, interpretation, observations, they call it, or findings, interpretation, diagnosis, differential diagnosis, and management. And management is something that a lot of people find challenging from abroad. But if you attend kind of lots of sessions where management is being discussed, or you speak to your colleagues at work and you get your surgeon, you find out what happens to the patient if they had an appendicitis or if they had an aneurysm in the brain. What is the management? If you know how uh, the patient is investigated further and what do they do with the patient, especially in the UK, then most people will find that the long cases are easy because most people are good at getting the findings. Most people know how to come to a sensible diagnosis. But where they struggle is writing a good differential diagnosis, which is down to only two or three. You shouldn't write more than that. And the management section. So if you get good at this, then I don't believe the long cases are difficult. And the crucial bit around the long cases, I would say, is your typing speed. The quicker you type um, and get onto a typing course as soon as possible, the faster you can pass the long cases. The Viva exam is really testing your value as a practicing radiologist. So someone comes to you while you're in the office and says, I mean, in the UK, radiology is very much practiced in hospitals. It might be that you're in a clinic setup, you just do reports, you send it to the hospital, and they deal with it whatever way they deal with it. But in the NHS, you're sitting in a department, you're you are reporting and someone comes into the door, they knock on the door and they say, Koshy, please can you give me an opinion on this patient? And they give you the patient number, you type it into your PACS, and you give a viva, if you like. You explain to the doctor what you're finding. And that's the scenario. Or you're going to a multidisciplinary team meeting where you've got surgeons, you've got nurses, and you've got pathologists, and you're sitting there and you're the doctor on the dock, and an image comes up on the screen and you have to talk through it. That is what a viva is looking to reproduce. And so what they're testing is your ability to quickly observe, quickly interpret the images, and discuss different issues that arise in patient care, um, and also advise the doctor. So, for example, if you had a lung X-ray and then you describe the lung X-ray, then the surgeon say, "Oh, there's a CT as well," and then you look at the CT in the MDT meeting, and then while you're scrolling through it, the surgeon is asking you, "Okay, thank you. You know, you're describing the findings," and then they're saying, "Okay, what should we do, Dr. Jacob? What should we do?" And then you have to say, "Oh well, this lesion is near the bronchus, so I think the best way to get to this lesion is to do a bronchoscopy and do a biopsy, or maybe the lesion is peripheral, and you'll say, okay, I this lesion is quite peripheral, so I'd recommend a CT guided biopsy." And then they might, I mean, usually the surgeons know what to do, but in the exam, you might go a little further and say, you know, these tumors are usually squamous cell carcinomas or adenocarcinomas, and the biopsy will help decide whether it's chemotherapy, radiotherapy. So knowing a little bit about the management is really helpful. And that is where British radiologists seem to, or candidates seem to do well, because they are in a hospital, they work in a hospital environment. So my advice to you, even from today, is to start asking your clinicians and getting to know what they do with the reports that you send. And I believe that this practice should be started at 2A onwards. From when you start preparing for 2A, if you start knowing what the management is, if you know how the patient presents, you know, does it, what are the clinical features of that disease? I think you will do better in 2A than the kind of people who just use textbooks like Granger and Allison. There are lots of people who they just look at Granger and Allison and they think they can pass 2A. I'm afraid that's not the way to pass 2A. Yes, you need Granger and Allison to give you the knowledge, but and you need questions. That's good because then you're familiar with the questions. But I'm a strong believer that the best way to practice for the theory exam, especially the FRCR 2A, is to start getting into seeing cases, looking at images, and learning about the clinical scenarios. Because once you've passed that exam, sitting 2B is much, much easier. Okay. So, my advice to you guys who are preparing for this exam is start thinking clinical. Get your anatomy and physics out of the way, and then start attending Viva sessions. Do a little bit of reading, do some question banks. I don't recommend looking at question books with lots of details. I don't think that helps as much. I think it is really getting stuck in. And if you ask, when I asked the Royal College examiners about 2A, which is the theory exam, they said what they want is people who are practicing in the UK or practicing radiology and knowing the clinical aspects and learning on the job, maybe getting access to things like RITI. Again, maybe Joanna can give you a link to the RITI, which is a sort of textbooks written by the Royal College of Radiologists, by various consultants, and it's very useful to prepare for the FRCR. Reading Grade Analysis is very good, but I think the RITI is particularly good. Also, doing some journal reading, you know, especially the latest review articles can be helpful. So that kind of preparation. And for 2B, it is simply a choice, a case of doing lots and lots of practice of cases, long cases, rapids, and vivas. And I'm glad to say, actually, revised radiology can help you through all that. In fact, you don't need anything else. This is a typical rapid reporting question. All you have to do, you've got a platform which we have reproduced exactly as the exam, at the cost of several hundreds of thousands of pounds. We have created a platform which reproduces the exam. You have to choose whether it's normal or abnormal. And then if it's abnormal, a little pop-up will come, a little box will come down, and you just have to say what the abnormality is. And when you get onto the journey, you know, we will help you, we will fine tune your process. With the long cases, it's equally simple. You get 6 questions, which you have to do in 75 minutes. and you get CT scans or MRs or plain whatever. You get a multimodality. About 50% of the cases will be multimodality, and about 50% will just be one modality. And they will make it in such a way that you can finish it in 75 minutes. So you need to scroll through the cases. I mean, this is just a static picture, and you need to fill in, you need to type in all these bits, which is observations, interpretation, principal diagnosis, differential diagnosis, and management of further treatment. Um, so the 2B is simply you have to pass 2A, and the candidate should have done 34 months of radiology. If you've done 34 months, which is literally just under 3 years, you can do the FRCR 2B exam. So this is your path summarized again. FRCR, this is what I recommend. If you are a trainee, if you're a consultant in your country, this is not what just do them one after the other. But if you're a trainee, my recommendation to you, and if you have any sort of thoughts that you want to do the FRCR in future, what I would recommend to you is do the FRCR while you're doing your exams, your local exams. So if you're in Nigeria or in India and you're a first year registrar, do your FRCR part one. When you start getting to the end of your degree, the end of 2 or 3 years, I would do 2A, because by then you'd have got all the knowledge that you need and you might have actually sat your exam. And my suggestion is sit your MD exam or local exam, whatever it's called, then sit your 2A. Okay, don't sit your 2A first. Finish your MD, sit your 2A pretty much a month later or 2 months later, and then because by then you've got the theory knowledge, you've already done your range of analysis. All you need to do is just start fine tuning your preparation to become more clinical. And during your training, always ask the clinician, talk to the clinicians, ask them, what do you do? How is this patient managed? You will start picking up over time a good amount of clinical knowledge. And then I would recommend 2B, maybe an year after your end of your degree, or at least 6 months, maybe 6 months to 1 year later, do your 2B exam. So then at the end of 4 years, presuming that your own local degree is 3 years, you have finished your FRCR, which is a fantastic position to be in. Okay. Sorry, I'm just trying to mute some people. Okay. So uh, I would suggest 6 to 12 months of preparation for part one, about 6 months of revision for 2A, and I would recommend 6 to 12 months for FRCR 2B, only because it's not cramming in that makes a difference. Of course, people pass after 2 months, but it's an expensive exam. Why not do it properly? And the more you prepare, the better you'll become. So give it 6 to 12 months of preparation. Don't sit it, 3 months before and literally like a Russian roulette. You're likely to pass or you can't pass. Give yourself the confidence that you need to pass. And that's what Revised Radiology, for example, wants to do. We want you to pass first time. And that's partly because of my own experience where I didn't pass first time. And I know what the agony is of failing. But I also know that if you don't pass, that's okay. You become a better radiologist. The important thing is that you keep training. Now, what are the costs involved with sitting the exam? This is the costs from the Royal College. I would just recommend you take a screenshot. My suggestion to you, even though it costs a bit of money, is to become a member of the Royal College. Anyone can become a member. So become a member and then you get discounted fees. And then when you become a fellow, then you obviously pay the fellowship fees. So those are the fees. If you want to take a screenshot of that, I'll leave it for a few seconds. Now, as you can see there, the exam is not cheap. It is a fairly expensive exam, and you can do it in a lot of centers now. In Cairo, if you're in Africa, you can do it in India. You can do it soon, I think, in Pakistan, and maybe even in Dubai. But my and it really does not make a difference where you sit the exam. I have a lot of people who say to me, "Oh, should I come to London? Is there a better chance of passing?" Honestly, no different chance because the examiners never meet the candidates. Okay, you're actually face to face. The 2B exam, which is the only time that you actually face someone, you're actually you may be in London, but you're not even seeing them. You'll be doing it over the internet. So literally, it doesn't matter where you are. You can do the exam from Timbuktu for all I care. You know, it doesn't matter as long as the you sit it where it's convenient for you and where you can reduce your costs. Um, so that's the cost of the exam. Now, obviously, preparing for the exam can cost you some money, but again, if you're prepared to do some work, we have a number of scholarships available to help people. Obviously, you need to make a little contribution, but there are situations where we support people completely. And usually, what the scholarship requires is that you do your part to to help the radiology community. So in some way, maybe it's providing cases, maybe it's looking at cases we have and improving them. It may be giving us rapid reporting cases from your practice. It may be even giving us a promise, and there will be a promise of you examining afterwards, being an examiner yourself. So we have scholarships available and we give them to people who are really motivated, okay? We don't just give them to anyone, we give them to people who are motivated. And it starts from 5% off our courses up to even 50%. It depends on how much you're prepared to do towards the scholarship. So I'm going to just go through quickly about preparing for the exam. My biggest recommendation for the anatomy is to actually use a website called eAnatomy, um, because you get X-rays, MRs, CTs, and you get to see it points out like you would in practice all the different parts of the body. So that's one thing. The other one is you could use an imaging atlas, but I personally think imaging atlases are a little bit old-fashioned now, especially with modern, the ability to look at um, data sets in real time, which is how the exam is tested. And also because they could take a cross-sectional image of a sagittal or a coronal, and unless you've seen it in coronal and sagittals in practice, you won't actually know what you're looking at. So my advice is use high quality anatomy and imaging atlases that are online, that are scrollable, or have pointers to them. I would also recommend two anatomy sets. One is Radiology Cafe, which has a number of free anatomy tests. I think there may be 15, and Revised Radiology, which is paid, but which are very similar to the exam as well. In terms of part one physics, the RETI radiology is very useful because it has comprehensive notes in addition to FAR, which people say to use. But I think if Joanna is online, she can say, but I would say that FAR is a little bit, there's a lot of information there that may not be up to date. So I think RETI is good, and I believe that most of the questions are set from that. The other thing is to use the FRCR physics notes, which is a Radiology Cafe, which is completely free. FRCR exam prep gives you practice questions. And with revised radiology, we will be having practice questions over the next 2 months. And in fact, they will be very comprehensive. But we also run physics webinars, and we also have recordings of a whole series of webinars that Joanna did. And Joanna is our physicist, our resident physicist. She's also our CEO, but she's a physicist in heart. So she does the whole thing. In terms of 2A, read your books. So read Granger and Allison, which you would have done anyway. I've been told that Crack the Core, Volume 1 and 2, is very useful. And if you're going to do one or two sort of single best answer ones, then I would suggest the one from the Oxford book. Um, and really, that's maybe all. And you could also do FRCR exam prep, which also has a really good FRCR set of questions. But we can also, the revised radiology is pretty comprehensive in that it gives you FRCR exam prep. It gives you StatDX, which has 16,000 or images, and no, actually 100,000, more than 100,000 images, and lots of topics. So you get StatDX for 6 months, and you get to attend and observe vivas. So revised radiology can help you for 2A. But the 2B is really where we have focused all our energy, because that's the final exam. And for that, we've got, I think I couldn't recommend anything else, because I know the amount of effort we've put into this. There are lots of things out there, which we've used in the past, but the advantage with doing it in a platform that mimics the exam is that you're not surprised when you get to the exam. And just go to the testimonial page on Revised Radiology, and you'll see the reason why people use our packets to pass the exam. So we give rapid reporting, we give long cases. There are monthly online vivas every month, and it starts from 4 a.m. GMT to 4 p.m. GMT, to cover all the different time zones. And we have 3 to 4 study groups every week where we give the cases, and the candidates take turns in being examiners and candidates. So we divide the cases by two. You practice, you look at the cases, half the cases, and then you're put in a room together, and then you examine each other based on the cases that you've got. And so the candidates who are being examined haven't seen the cases before, and that's really useful. And we are also going to introduce some new concepts to the study groups, where we ask you to practice as a tough examiner, and we'll give you some scenarios that we'd like you to practice, so that you get practice between yourselves of being the silent examiner, the examiner who interrupts all the time, and the various kind of scenarios that we know happen in the actual exam. The other thing that I recommend is that at least before the exam, it's worth going on a comprehensive course where you get 15-minute on vivas, and you get examined by an experienced post FRCR examiner. Many of our courses have been set up using Royal College examiners in the past. So that's really the way I suggest you prepare. If you take a screenshot of this, this is the way to contact us. I'm very happy to be contacted on Telegram, and I'd very much invite you to join our Telegram group, which, as Karthik rightly said, has over 2,500 people. We've probably helped about 4 or 5,000 people pass the exam over the past 15 years, maybe more than that, in fact. But we've got a really good community here. So that's what Joanna has put there, is the channel. But there's also a group which I think she can put the link to, so you can join the group as well, and you can ask questions. And I'm hoping that to see you, as many of you as possible, to help you through your journey. Um, at this stage, I don't know if there's any other questions that I can answer. Let me just look at the questions quickly. And I saw, let me see, I've seen one question. Do you need CSER for teleradiology or just FRCR? You need CSER in order to do teleradiology. FRCR is not enough. In order to do teleradiology for UK providers, you do need CSER. And is there any other questions? How soon can I appear for the FRCR Part 1 after post-graduation? Pretty much straight away. You can appear for the next one. And then Dr. Barra would like to know if there's an FRCR 2A course, like the long one. So we do have a sort of an offering for 2A. And what we do is we give you everything you need in terms of FRCR exam prep, the clinical knowledge you need, and StatDX. And I believe that is enough to pass. But I would also say, if you want, you can also do the Oxford MCQs, which I believe are available here and there. You can buy them from Amazon or online, I believe. And yes, I would very much like to connect with you on LinkedIn, which is also really a very helpful tool to get seen and known, especially after you've passed FRCR. It's a very useful tool when you're looking for jobs, when you're looking for teleradiology opportunities. So get yourself a LinkedIn profile and certainly connect with Karthik and myself. So that was a sort of whistle-stop tour of the FRCR exams. We haven't gone into much detail, but the detail will come. And if you join FRCR, if you just make an account with Revised Radiology, there are a number of free webinars that I have recorded, which are available for anyone to watch, which go into detail, particularly about 2A and 2B. Anatomy, I think I've pretty much covered it in this webinar. You literally just need to do what we've recommended there.
Super, wonderful. Thank you very much, Koshy. That was indeed a great insight of FRCR. In fact, I've learned a lot actually. Super, thanks very much indeed. I think it's been super duper helpful. I'm sure what we'd like to understand from the participants is what is that you need. I mean, we could talk a lot on FRCR with Koshi's experience, insight, etc., etc. So, what is that you need that would make the difference in your career towards FRCR? You know, the small tidbits of whatever that you would need, if you could highlight it to us, then we could develop on those as we go by actually as well. I mean,
Exactly.
this that would be, I mean, feedbacks are very important. I mean, this is a broad overview of what you should study, when you could appear for exams, cost of exams, connections to different links in Koshis and myself, etc. But if you can take time, come out and tell, you know, these little things might make a big difference, or whatever you have experienced in
Mm.
attempting a FRCR, what you thought was the missing link, every little things would help. So we'd like to hear from you, you know,
Yeah.
individually or wherever you have all our contact numbers. So please feel free to come back to us.
Yeah.
And as Koshi did say, keep connected with us
Yeah.
even examination.
If you connect with us on Telegram, then I'm very happy to share my phone number, and we can fix up a call on one-to-one call to give you a sort of, or one of the team anyway will be able to give a one-to-one strategy call with you completely free. We're here to help people, and I just want to say another thing about costs. Okay, people often say cost is a big limiting factor, and it is, because these amounts in a local country can be quite expensive. But think outside the box. You're a radiologist. You have got many of you will have a qualification in your own country, and you can practice. What else can you do with your qualification? Can you join a teleradiology company like Quest? Can you do work for in your own country? Can you join a teleradiology company with your qualifications locally to afford the fees needed? Can you be a little careful with your spending? Can you prioritize the exam first? Because once you've got the exam, your income just shoots up. It's an investment. Think of it as an investment. It's like investing in the stock exchange or investing in a property. You invest in a property and you get the returns. And that's what I'd like you to think a little bit. Um, about the whole cost issue when you're thinking from from the perspective of a radiologist. And if you are a trainee and you are struggling with finances, reach out to us, because we do, as we say, we have scholarships, and there is always something that you can do for us that will be of value, I'm sure, as a radiologist. You've got to put in the work, but the scholarship is not, it doesn't come without some kind of exchange of value, but I'm sure we can work something out that will make it affordable and possible for you to sit these exams. We will work with you on that. There's a question here. I have been seeing the junior doctor strikes. Does it affect radiologist perspectives in any way? Absolutely not. In fact, probably increases your prospects, if any, because the more junior doctors leave this country, the more we need doctors to replace them. A lot of doctors from the UK are moving, to Australia. They can because they can. Australia and Canada, they certainly pay more, but it's not easy there either. You have to get their local qualification, but people try and move. But at the end of the day, that opens up a huge opportunity. The opportunity to work in the UK is massive. Okay, and think about it like this. A lot of people say to me, and I speak to people almost every week, they say things like, I don't want to move to the UK. It's cold, it's expensive, I won't save anything. But what you don't realize is that even working in the NHS, again, is an investment. If you've worked in the NHS, put that on your CV and see what doors that opens for you in the Middle East or in Africa or in India. I challenge you, if it doesn't increase your opportunities, the fact that you've worked in the UK, doesn't it open up opportunities in your own countries? So again, working in the UK, it is an expensive country to live, but it's an investment and you're not going to starve. You will get a relatively good income. You may not be able to save the same amount of money, but just the fact that you worked in the UK as a consultant or junior doctor will open up opportunities. So for me, my suggestion is don't listen to the news. There are huge opportunities for doctors and for radiologists from across the world to come and work in the UK to pass the FRCR and all that. Um, does Revise train in parts? Yes, we train for every part of the exam separately, absolutely. And if you go to reviseradiology.com, you'll see that we have sections for each part of the exam.
Super. I think that
I
pretty
think
much
that's
covers. Yeah, I
covers
mean,
a lot of questions.
yeah,
Yeah.
there are lots of questions today, Koshy. Thank you very much, indeed. No, I think that's been really, really. I mean, it's I'm sure it's be. I mean, we will hear a lot from different candidates from different countries because we are
Yeah.
in touch with them, so we will get an idea what what more they need or what is their feedbacks,
Yeah, and
etc.
also there are lots of webinars we run, both in
Mm-hmm.
terms of radiology content, but also what we call Achievers Webs meets, and those are to do with mindset because I believe that mindset. I'm a coach myself. I believe mindset is an incredible part of what it needs to become a good practicing radiology. You need to have a positive mindset. Like Karthik here, he's got a fantastic mindset. So people like that, are unfortunately rare. Most people complain. They find work difficult. They complain about everything. But life is about opportunities, and I just want to say, the world is your oyster. You have an opportunity. Whether you do the FRC or not, you've got massive opportunities out there. You just have to believe in yourself. And sometimes having people there who are supporting you, who can coach you, who can ask you good questions to make you think, is all that's needed to have a successful career.
Very true, very true. Brilliantly said, Koshy. It just opens up a window. It just really does, actually. In
Yeah,
fact, the window is the world, unfortunately or fortunately, however people look at it. But yes, it does. Yes, it does. People wait for the door to open, but actually, if you go and open it, you see the opportunities.
absolutely.
Super. Wonderful. So on that note, let's close the day. I think everybody at
Yeah,
different places. Let's get on with whatever their evening is. Once
yeah,
again, I thank Koshi and
yeah.
the Lotus team.
And
There are a lot of people behind Joe and the team, etc. I'd like to personally thank each and every
yeah,
one to make this a very successful one. And to all the candidates, friends, we will hear from you. As we said, utilize this opportunity, the connects, the contacts, the revised team,
Yeah.
etc. And as coach has been saying, make yourself better, and every little step, whatever help you need, feel free to post a question. Unless you ask a question, you ain't gonna get an answer.
Yeah,
So,
join the community anyway. Join the
Mhm.
community, whether you decide to sit it or not. Just join the community, and in the right time, it'll open up. And I just want to thank you, Karthik, and
Pleasure.
Niru, for the opportunity you've given us to speak to Africa and to India. It's fantastic. Thank you so much for.
Pleasure, Koshy.
I just want to say one thing. I lived in Africa for 10 years. I lived in Nigeria when I was a child, so I'm very much understand at least West Africa.
Got it.
I really enjoyed that time there when I was a boy, and I've lived in India as well. So all these areas are close
I
to
didn't
my
know
heart.
that. I
Yeah,
didn't know that. See, that's a secret I knew today, actually. But that's good to know. And a trip along with me is waited in Africa, so no worries, we will go there.
absolutely. Good, good. Looking
Mhm.
forward to that. Thank you
Super.
all.
Thank you. Thanks, team. Thanks, everyone. Have a lovely evening. We'll
Okay,
close the session.
thank
Thank
you.
you.
Thank
Bye
you, doctor.
bye.
Thank you. Thank you. Thank you all. Bye.
Thank you. Bye.